Assalamu alaikum wa rahmatullahi wa barakatuh. It's my pleasure today to join this prestigious conference. I'm Dr. Dalal Nasr. I'm developmental pediatrician and the head of mental health department at the Medical Heart Center Al Ain. I'd like to thank the organizing committee and Dr. Tariq Adabi for inviting me for this conference. Today I'm going to speak about one of the hottest topics in the era of developmental pediatric, about the autism updates. By the end of the lecture, we are going to know about the early signs of autism, screening and diagnosis methods, benefits of early intervention, and the barriers also to early intervention, and the negative and positive side effects of the screen exposure in the ASD child. As you know, that autism is a neurodevelopmental disorder that affects usually the communication, social interaction, and behavior of the child. About the prevalence of autism, it's increasing nowadays. It's going up in all the countries. The data says that it's estimated that it's 1 in each 54 children in US. And as you know, the boys is 4 times more than the girls to be exposed to ASD. Early detection of symptoms of autism usually lead to early intervention, which reflect on the outcome. So the better or the as early as you detect symptoms of autism and start the early intervention, better the outcomes for the child and the family as well. The symptoms of early autism or signs of autism can be detected as early as 6 months, not as we used to know before that it's by age of 18 months. So now the research say that it can be detected by almost by 6 months by tracking eye tracking technology. So what is the early signs of autism? It's the delayed or absent of babbling, pointing, gesture, and communication. Difficulty for the child to make direct eye contact, respond to the name and commands. Usually the child will have repetitive behaviors in form of repetitive hand flapping, rocking of the body. And also there is intense interest on certain objects or topics like certain sounds, smells, and food, some kinds of food. All the signs can indicate signs of autism. How the American Academy of Paediatric recommend to have an early detection of autism. They recommend to have to check the child and have the questionnaire of MCHAT in the Well Baby Clinic, starting 18 to 24 months. The screening and diagnosis of autism involve developmental screening. As I said, there is MCHAT that can be used in the Well Baby Clinic by starting 18 months until 24 months. If the child is normal by 18 months, it should be repeated also in 24 months. If it's suspected by 24 months, the child should be referred to the developmental pediatrician for further diagnosis and assessment. The diagnostic evaluation should be done by developmental pediatrician. It depend on its observational assessment, or its interview with the parent and the caregiver and the child as well, or its comprehensive assessment with the developmental pediatrician. So what is the benefit of early intervention of the child? The early intervention, it means there is early detection, and it will early improvement of the child communication, social skill and behavior, and it will definitely reflect on his academic performance, and the outcome also will be reflected on the family. It will release the family stress and decrease the stress of the family, and it will improve the quality of life of the child and the parents as well. So there is some barriers to have early detection of the autism. Some of the barriers usually most of us are facing in our community, especially in the Gulf area. We have lack of awareness, and we have also parent denial, which is I feel this is the most important point. The child can be detected late because of the denial of the parents, or limited access to the diagnostic services, or like cultural beliefs, or the parents usually take time to be convinced that the child has a problem, and they will usually follow the families beside them. We say, no, don't go, it's normal to be delayed, don't interfere now. There is we have one of the family member also was delayed. That's why they are following the culture and belief around them. So what we should do when you find that the child is already delayed, so we have to have an action to be immediately. We should go to seek medical advice. We should provide access or facilitate the access to the diagnostic services. and we should address the culture and linguistic barriers. So I would like to speak about the screen time and exposure in the child, the normal child and an ASD child as well. As we know that autism, usually the autistic child have a more prominent risk of developing harms and side effects when they are exposed to screens in comparison to the normal child. Okay, so depending on the amount spent of the time spent on the screen, the child was going to develop the harm or the side effect. Whatever the screen type is, like the screen time type is it's computer, iPad, laptop, TV, whatever, it's a mobile phone. We can just gather all them under screens. So it depends on the screen time and the type of the screen the child exposed. We'll have the debate that it could be the screens is the reason or the cause of developing autism symptoms or not. But it's part of the risk factor. I mean, it's one of the risk factors that the child can develop autism. Specifically on the autistic child, if he exposed to the screen more than the usual, like more than 1 hour, if he is more than 2.5 years, he will have negative effect. As researches that shown that excessive screen time can cause negative effect on children development, especially the ASD child. So in form of defect or affection, it will have negative effect on the language skill, attention span, social interaction skills, and also it will be reflected to the learning difficulty and disability for the children. The children with ASD, as I told you, they are more prone to develop side effects for screen exposure in form of increasing the hyperactivity, increasing the irritability, and difficulty in sleep, especially if the child exposed to the screen like 1 or 2 hours before sleep time. It will also interfere with the development of the important social skills and communication skill and social interaction of the child. So mainly the children relying on the screen and exposed more to the screen, they are the one develop more symptom or more side effect of the screen. So what we should do, we should inform and educate the parent that the screen should be used specific guidelines or we should put a specific routine for the screen. We should limit the screen time, especially for the child with ASD. We should make a guideline, like we should inform the parent that it should be under parent control. It should be specific period of time per day. It should be the type of the screen or the videos or whatever the things that children exposed to. It should be more educational part or more quality part of time, just to get the benefit from it. So I'm speaking about the side effect and the negative effect of the screen. So all of us know that there is a huge debate about the benefit and side effect, or the pros and cons for the screen exposure. We couldn't deny that there is a benefit for the screen exposure, especially this is ASD child. The child who has poor communication skill, he has poor face-to-face conversation, he has poor eye contact. Some of them we make use of the screens, like we can use the screen in a specific program or learning or educational program that they can use a text message on it or video chat or can do skill building and educational program for the child to improve the social interaction and language development and academic achievement. But it should be, as I told you, and should be under specific guidelines and should be with the specific boundaries to set the screen time, like to assign that today we have to have only 1 hour or less than 1 hour per day. So we should also keep them at home tech-free zone, not all the time. That's like TV it's a habit in our families that to keep the TV open for 24 hours, which we can say that a 24-hour screen or background screen, it has the same effect of exposure 24 hours. So we should make a tech-free zone in home and under parental control if we are using the screens. So we should also have a balanced time. Using the screen time at home, we should have outdoor play, social interaction, creative plays, or we should join the child in a creative activity outside home. So what is the future direction of the autism? There are many exciting updates and development on the horizon on the area of research that show that promise to the use of gene editing technologies to target the specific gene which is associated with autism. This is the new era of in treating and diagnosis and treating autism. Additionally, the artificial intelligence is going to play a big role in improving diagnostic tools and personalized treatment plan for a child with autism. So what the conclusion today? The relationship between the autism and screen time is complex and multifactorial. While exposure or excessive screen exposure may cause increased risk for individuals with ASD, technology also can have benefits on the child with ASD in form of improving the communication and social skills, but if it will be under control and monitoring with the parents. So as we know that early detection it means that early intervention, it means that we have better outcome for improving the child with ESD. This is my reference. Till now, I finished my presentation. If you have any question, you are welcome. Thank you.